Thank you so much for having us. My name is Dr. Erin Donald. Myself and my colleague, Dr. Meagan Nolan, will be presenting today. So I'll just launch into it. And Dr. Nolan, if you want to take it away.
All right. Hi, I'm Dr. Nolan. We thought it would be beneficial to start with some definitions and concepts of what palliative care is, because there are some people that have misconceptions about it. So sometimes when we talk about our work to other people, they think it means giving up or throwing in the towel. That can be a really hard thing for patients and loved ones to hear when we start talking about palliative care with them. But actually, the guiding principles of palliative care is living well until you die. Palliative care is about comfort and excellent management of symptoms like pain, shortness of breath, fatigue, and others that can afflict people at their end of life and in their illness trajectories. So, a palliative approach, what is it? It's about maximizing the quality of life and managing symptoms anywhere in the healthcare system. And it is care that can be delivered by any healthcare provider. It is an approach to the care that someone can already be receiving, be they in hospital, long-term care, or recovering at home. And it brings the principles of palliative care to any type of treatment, and ideally should start early in the illness trajectory. What is palliative care? So palliative care is a whole person care that treats someone with a serious illness and their chosen family, friends, and close support systems. It is also focused on improving their quality of life and managing symptoms, as well as providing psychosocial, spiritual, or decision-making support as an illness changes someone's life. Palliative care also includes bereavement support for loved ones before and after someone has died. Palliative care can be provided by healthcare providers in any setting or in partnership with specialist teams. While palliative care often plays a larger role in someone's treatments as their illness advances, it can be in place while someone is still receiving active treatment that is intended to cure. So some people believe you can only have palliative care at your very last little bit of life, but that's not true. We would prefer it to begin when somebody has been given a life-limiting illness, because then we can help in many ways. And what is end-of-life care? End-of-life care describes the care that is provided to someone in their final days and weeks. This care continues to be whole person centered and guided by an individual's wishes, even when they are no longer able to speak for themselves. Hospice care. How is this different from hospice care? Well, hospice care in Huron County provides palliative care to individuals and their loved ones with a serious illness who are no longer receiving treatment intended to cure, either because it's not possible to cure their illness or because the burden of treatment is outweighing the benefits for them. In Huron County, hospice is not restricted to the last 2 weeks of life, but can be an option for individuals and their loved ones to spend their final months and weeks well supported by healthcare providers with expertise in palliative care. We'll talk about that a bit more later, but first let's talk about what we mean by a serious illness. So a serious illness can be any illness that is life-threatening. When we talk about serious illnesses, we were referring to cancers, yes, but we're also referring to illnesses such as congestive heart failure, chronic obstructive pulmonary disease or COPD, renal failure, which is kidney failure, liver failure or dementia, or any other illness that can lead to a decline over time and potentially shorten someone's life. We have made great advances in caring for people with serious illnesses towards the end of their lives, but too often a person's decline and death still comes as a surprise to them and their loved ones. Despite this feeling of surprise, there are almost always signs in serious illnesses that can act as signposts to healthcare providers, family members, and patients themselves. These can help cue important conversations about healthcare options, goals of care, and future plans. While everybody's individual illness journey is different, we know from studying large numbers of people that different illnesses groups tend to follow different patterns. So if you look at this graph that is presented, so the first line there in purple is sudden death. So that could be from a motor vehicle accident, a heart attack, a stroke, or a blood clot in the lung. So that is a pretty quick, swift death in time. The black line is cancer deaths. So you have a kind of slow decline for quite some time. And then as the illness progresses, a slightly steeper decline until death. And then at the end, a fairly swift decline. The red line is organ failure. So that could be chronic kidney disease, that could be congestive heart failure, chronic obstructive pulmonary disease. So that if you notice, they are not functioning at their high functioning level. They're kind of in their middle function in their lives, and they slowly deteriorate, and then they have a sudden decrease. So this could represent a acute exacerbation or a hospitalization or an ER visit, and then they recover, but not quite to the level that they were at before. And then they slowly decline again, and then another drop and another slight recovery, but not quite to the level they were at before. And this continues over time until they have a more steeper decline towards the end. And then at last, the blue line is physical and cognitive frailty, such as just getting old age, and cognitive frailty, dementia, Alzheimer's. So they're functioning at a very low level, usually needing some supports, and then they just slowly decline over time until their inevitable death. One thing to point out, though, is some cancers, instead of following the black line, with all our advances in cancer care and symptom management and treatments, can sometimes follow the red line more closely. So cancer doesn't always follow the black line. Sometimes it follows the red line. Okay. So what are some signs of decline? So each serious illness has its own course, as we said. But signs of decline in one illness, such as congestive heart failure, aren't the same as signs you might see in cancer or lung disease. But us physicians and healthcare providers, we don't always have a crystal ball, but there are some things we do look for to see how that can point towards a significant decline in the final months of someone's life. So some of these signs might include weight loss, limited functioning. So they may be not getting around as well as they used to. They may find self-care tasks to be more challenging, may need some more supports in the community, some PSWs, some nursing care. And they may be spending more time in a chair, on the couch, or in bed, not getting up as much as they used to. Decreased appetite. Sometimes this just happens with age, but sometimes in illness, it definitely is a big issue. Another one that we see quite often is increased emergency room visits or hospitalized admissions, especially visits that are happening more often towards their end of their life. Shortness of breath with activity or rest is another one. And this is a very powerful diagnostic sign in someone with heart disease, lung disease, or lung cancer. And sometimes there are other specific illness markers, such as swelling in the legs or abdomen, which we might see in somebody with heart failure or liver failure. So understanding the trajectory of a serious illness and knowing some of the signs of decline helps trigger us to think about when it's time to start to revisit some more important conversations. Okay, so many Canadians may not even be aware that the illness they have is one that is anticipated to worsen or shorten their lives. So serious illnesses can include illnesses with the possibility of a cure, but it doesn't always work out for the patient. That's why you'll sometimes hear the phrase, hope for the best, plan for the rest. So many Canadians also hope and expect that the right person, a doctor or a nurse practitioner maybe, will tell us clearly and plainly at the right time when we're ready to hear it that an illness is life-threatening, and we should gather our questions and start making plans. But for one reason or another, this doesn't always happen. There may not be time for the discussion. We may not always hear what our care provider believes they have clearly conveyed. This sometimes happens where I've told somebody, about their life-limiting illness and they didn't hear what I said or weren't able to hear what I said. They weren't ready for it. Some of us have very limited access to healthcare providers and maybe receiving a diagnosis for the first time in a very busy emergency room or a hospital ward, may not have access to a family health team or nurse practitioner. That's why it's important to be ready as individuals to start these conversations or revisit these conversations ourselves, empower ourselves to ask the important questions. So Health Canada recommends that we ask our health provider these 3 questions. when we're given a diagnosis? Is this illness curable? Will it get worse over time? And will it shorten my life? And then some other questions that we recommend would be, can you explain the different stages of my illness? Am I currently in the beginning, middle, or end of my illness? And another one to ask is, and what milestones and decision points are ahead in my illness, and how can we plan for them?
All right.
Aaron,